Welcome to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please welcome your host, Dr. Carri Drzyzga.
Hello everybody, and welcome to the Functional Medicine Radio Show, the only internet radio show dedicated to giving you real solutions to improve your health. Not only are they real solutions, but they're natural solutions as well, because as you know, the one and only true wealth you have is your health. I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc, and I'm committed to helping you find the root cause of your health problem, fix the cause with natural treatments so you can feel normal again and live your life to the fullest. Today's show is all about histamine intolerance. So if you are sick and tired of feeling sick and tired and you've tried everything and nothing has worked for you, it could be that you have histamine intolerance and nobody has figured that out. I'm very excited to have Dr. Janice Joneja on my show today. So let me tell you a little bit about her. Dr. Joneja holds a Ph.D. in medical microbiology and immunology. She's a registered dietitian in Canada and a member of the Academy of Nutrition and Dietetics in the USA. She's held faculty positions at several universities, including the University of British Columbia, and for 13 years she was head of the Allergy Nutrition Clinic at the Vancouver Hospital and Health Sciences Center. She has authored 8 books and dietetic practice manuals on food allergy. Her work has been published in peer-reviewed scientific and medical journals, as well as in popular magazines. She is a respected lecturer at universities, colleges, and hospitals internationally, and regularly appears on TV and radio call-in shows as an expert in her field. Dr. Joneja, thank you so much for being my special guest today on this episode of the Functional Medicine Radio Show.
Thank you so much for inviting me. I'm looking forward to it.
So I guess really the first question is, what is histamine? Because when I bring this topic up with some of my patients at my private practice at Functional Medicine Ontario, they're like, well, okay, first of all, Dr. Carri, what is histamine? So let's start there.
Well, it depends where you want to start with histamine. One can write a book on it, which in fact I'm doing, but histamine is a very, very important chemical in the body. It is very important for a number of functions. The one function that most people know about when we talk about histamine is allergy, because histamine is an extremely important protective chemical that is released whenever the body is under threat. Inflammation, a variety of insults, the infection, whatever is going on in the body that could be life-threatening, if you like, histamine is released. And it's also released in allergy, where people would be far more familiar with the symptoms. The symptoms of allergy are principally due to an excess, a large amount of histamine being released, so we can say its first function is protection. It's also needed for digestion. It's released as soon as you start to eat because it's very important in making sure that there's enough acid in the stomach to start the process of protein digestion. So it's an important mediator in digestion. And another extremely important function for histamine is as a neurotransmitter. That means it's very important in the nervous system to transmit signals between cells. And so we've got all these very, very important functions for histamine, but where we see it being a problem is when there's too much of it, and that's what we see, for example, in allergy, and as we shall see when we talk about it a bit more, in histamine intolerance, when there's in fact too much and it's doing things that we don't want the body to do at that time.
Okay, so again, histamine is protective. It's generated by the immune system, and we need it to help also with digestion, and it's a neurotransmitter as well.
That's correct.
Okay, so then what is histamine intolerance?
Well, that's when we're going into the levels of histamine. When it's doing its job perfectly and it's not overdoing things, you would be not aware that it's actually functioning. However, there are certain conditions in which too much histamine is going around the body, and it's now causing a problem. And the problem, as we can see it in allergy, where it's released in large quantities very quickly, is all of these symptoms that we associate with allergy, and then we call it histamine intolerance for the simple reason that the histamine has become too much for the body to handle, which means that in fact, the body's way of keeping the histamine at its normal level is to break down the excess. But if there's too much of the histamine for the body to keep up with, then we get this excess histamine causing problems, and this breakdown is due to certain enzyme systems. Enzymes are the chemicals that mediate the functions within the body, and if the amount of histamine exceeds the ability of the enzymes to break it down fast enough, it reaches a high level and we get all the symptoms that we would associate with allergy. And the problem being for people who are experiencing this is that they are assuming that they have an allergy. And often it's, oh, I have a food allergy. Because nothing else seems to be being a problem for them. And so they look into the possibility that they have allergy. They go for allergy tests. They are told that everything is normal, you don't have allergy, and they're at a complete loss as to in explaining why they seem to have all these allergic symptoms, and yet they're being told that no, you don't have an allergy. So we label this histamine intolerance, not histamine allergy, histamine intolerance, because what we are actually saying is that your body cannot deal with that level of histamine.
Okay, so for our listeners out there that have complex illnesses, you know, I heard recently, Dr. Janice, that the average patient that sees a functional medicine doctor, they have at least 6 diagnoses and at least 30 different symptoms. Does that maybe fit a histamine intolerance picture?
It certainly might, because the symptoms of excess histamine cover just about every organ system in the body. And so, yes, very often we're dealing with people who have multiple symptoms with no explainable cause, and they're at a loss as to how to manage this. Yeah.
I know.
So,
yeah, for a lot of patients out there, like they've seen a lot of doctors, they've seen the specialists, they've seen naturopaths, they've tried this, they've tried that, and they're just not getting better. So what are some of the symptoms that are really key for us to think, okay, maybe this is actually histamine intolerance?
Well, let's go through them in sort of the order that people may be aware, because the first thing we see with histamine is very often, frequently, itching. Skin, eyes, ears, nose seem to itch for no particular reason, and they've looked at allergies. No, that's not a problem. Some people break out in hives, which can, of course, be itchy. Those are those patches that are red, and they seem to appear and disappear in various sites throughout the body. Now, there's another situation in the skin that we call angioedema. This is really hives in the deeper tissues where we get swelling. So the swelling and the reddening and the itching may be a result of histamine being released in the skin. Now, another symptom which often becomes very frightening for some people, histamine causes a drop in blood pressure. we'll talk about the causes of why and how this happens. But because of the widening of the blood vessels, the heart has to finds that there's less pressure going through these widened blood vessels. So there's a drop in blood pressure, not a rise, a drop. And as a result, the heart sees, oh dear, we're not getting as much blood through the body, we'd better speed up. So the heart speeds up. So very often there's an increase in heart rate. Although the blood pressure drops, the increase in heart rate can be quite frightening for people. It's what we call a tachycardia. So this sometimes, and in some of my patients I've seen this, to actually escalate into symptoms that mimic an anxiety or panic attack. And that may even go as far as a chest pain, and people may be thinking, oh, I'm getting a heart attack. But no, it's just excess histamine. And then the typical symptom of allergy, which is nasal congestion, the stuffy nose, a runny nose. This is because fluid is moving from the blood vessels into the tissues and is making a sort of a congestion within certain organs. The irritated, watery, reddened eyes that we call conjunctivitis or rhinoconjunctivitis, which people with hay fever are very, very familiar with, that is due to histamine excess. Headaches. And then this, because of it being a neurotransmitter, we see fatigue, confusion, a sort of irritability. That is because of its role in the nervous system. And I have had patients who have actually, in extreme cases, lost consciousness, perhaps for 2 or 3 seconds, very briefly, and that can be due to histamine intolerance. And then we get, because of its function in the digestive tract, we get symptoms similar to heartburn, indigestion, reflux, because of the excess acid that results in the stomach as the histamine rises. So we can have all these diverse symptoms throughout the body just because we've got too much histamine.
And so then would you say, Dr. Janice, that in a patient that has histamine intolerance, they're not going to have all these symptoms, but they might have a few of them.
And a few of them on different occasions.
Yeah, and I think, too, that a lot of people over time, they get used to their symptoms and they just think it's normal for them, like the runny nose or the itchy, watery eyes, like it's just normal for them. and so they don't recognize it.
Yeah. Oh, my ears are itching. Yeah, that's right. Exactly. Oh, and I've got heartburn, and that sort of. Oh well, I know that it's due to too much acid, but one has to look at why are you having too much acid? Yeah.
Okay, so now that we have a better idea of what are the symptoms of histamine intolerance, now what really causes histamine intolerance?
Well, this is one of the questions that we're looking at very carefully, because what we would normally see is histamine being kept at the level that would not produce symptoms, and some people, and this can be an inherited characteristic, don't produce sufficient enzyme to break down histamine as it's being produced normally within the body. So this most important enzyme is called diamine oxidase. There's another one which is called histamine N-methyltransferase, but that's not as important as diamine oxidase in breaking down the excess. Histamine N-methyltransferase does have a number of functions, one of which is breaking down excess histamine, but certainly not to the extent of the diamine oxidase. So we're looking first of all at people who are perhaps producing insufficient diamine oxidase as a result of an inherited characteristic. So that's genetic. We then move on to the people who are producing a great deal more histamine than the body needs. We see this in allergy, where I don't have to sort of explain to people who have allergies what happens is they're exposed to their pollens, the animal dander, and they have respiratory allergies. They're producing a lot of histamine, far more than the body can cope with. Or people who have food allergies, and again, they're producing too much histamine. So allergy is the next one. The next one on the list would be people with chronic inflammatory conditions. Now, inflammation is always going to produce histamine, and these inflammatory conditions could be anywhere in the body. They could be, for example, chronic rheumatoid arthritis. They've got chronic inflammation, so they've got a chronic release of too much histamine. Then there's the group that we're looking at very closely now. The new research is looking at what we call mast cell activation disorders. Now, this is where people produce too many mast cells. Now, mast cells are the cells that actually make histamine in the body and store it. So all these mast cells are within the tissues throughout our body, waiting there to protect us. This is their function. They want to protect us. But in certain conditions that are diagnosed by medical tests, of course, a person may be making too many mast cells, and so they're producing too much histamine. So anything that triggers the release of that histamine from the mast cells is going to actually result in far, far too much histamine. So we've got this whole group of people who have mast cell activation disorder, and that will lead to excess histamine beyond which their own enzymes, which may be produced at a completely normal level, but because they're producing far too much histamine, it just can't cope. And so they're dealing with a lot of the symptoms of histamine excess, or we call it histamine intolerance or histamine sensitivity.
And then would you also say that there are certain foods that are high in histamine, and some of the diets out there that are popular right now are actually high histamine diets? And
exactly.
Yes. When patients go on these diets and they're like, I don't feel better, I actually feel worse, it could be you have a histamine intolerance.
In fact, a person with perfectly normal histamine levels and perfectly normal enzymes can exceed their enzymes. I mean, enzymes only have a certain level at which they can function. If they're overwhelmed, they just simply can't deal with the excess. And histamine can come from our foods. And a person who is perfectly normal in every other way can actually exceed their enzymes' capacity to break down the excess. So if we look at this in a simplistic way, we all have a certain level of histamine in our bodies that we require for all these functions, these very important functions that I mentioned. But it's like filling up a bucket with water. I used this simile years and years ago, and a lot of people have been using it ever since to explain why a person can exceed their level of normal level of histamine. And what we do is to look at all the ways that the body is actually producing too much histamine. So let's say a person has an allergy. That histamine bucket, like filling up a bucket with water, we put more histamine into the bucket, so the level rises. And then there may be that this person is eating a very high histamine. I'll give you one example of a very high histamine meal, which a lot of people love, which would be, let's look at pepperoni pizza and a couple of glasses of wine or beer. Now we look at all the constituents of the pizza. We've got tomatoes, which release histamine. We've got cheese, which contains histamine. We've got pepperoni, which contains histamine. And then we add on top of all that the beer or wine, which again contains histamine. So you can see how this level in the bucket is rising at each additional amount of histamine. And so when that bucket overflows, that's when the body has exceeded the ability of the enzyme to break down the excess, and a person experiences any or all of the symptoms that I've listed.
Dr. Janice, can you give us an example of a meal that somebody who's trying to eat a healthy diet would, as an example, would be high in histamine, as opposed to pepperoni pizza and a couple of beers?
That's pretty healthy, usually.
Just to make it more like realistic for our listeners.
They don't eat pizza.
Oh, I bet they do on occasion. I mean, I do on occasion.
No, we have to look at the types of foods that have high histamine. The first we could look at would be the fermented foods. Mm-hmm. Whenever microorganisms are breaking down proteins, histidine is an amino acid that is part of a protein. And that histidine will be converted to histamine when bacterial enzymes start acting on it. So anything that is fermented will contain a certain level of histamine. And that means, for example, a person can drink milk with no problem whatsoever, but if they start to consume a lot of cheese, yogurt, any of the fermented milk products, they're consuming more histamine. As I said about the fermented sausages, the meat is okay, but when you start to ferment it, then you've got histamine. Even vegetables are great as long as they are not overripe, because as soon as they get overripe, the bacteria start converting histidine to histamine. And pickled or vegetables such as sauerkraut, for example, where the bacteria are acting on the food, there we've got the release of histamine. So fermentation, a very important level. Certain foods themselves contain histamine naturally. Examples of these are fruits, actually, more than vegetables. As they're ripening, sometimes will need histamine in the ripening process. For example, tomatoes can be high in histamine as they ripen. The green tomatoes are fine, but as they ripen and go red, then we've got histamine. There are other vegetables such as eggplants, certain fruits, for example, contain more histamine than others. The citrus fruits are one of those. I've got lists of these, of course, in all my publications, so people can go to those sources to find out the foods that are high in histamine. Again, anything that is exposed to microorganisms that will start to act on proteins will convert the histidine to histamine, and an example of that would be fish. Fish that is freshly caught and gutted has no histamine. You smell a fresh fish, it doesn't smell like fish, but if you leave it to hang around for a while, then the bacteria in the gut of the fish will start to act on the protein and convert the histidine to histamine. So that's an important consideration for people with histamine intolerance. Make sure that the fish is freshly caught and gutted or immediately frozen. Do not eat shellfish, because we don't gut shellfish, and often they're hanging around on ice, for example. That's not cold enough to stop bacteria from acting on the flesh. So shellfish is another source of histamine. And then another addition to the list would be certain food additives that actually act in the body and can release histamine. These are principally benzoates. They are used as additives in certain foods as preservatives. Tartrazine, which is a yellow dye, a color which is used a lot in foods and medications, and sulfites. These are additives that can release histamine and again can contribute to the histamine level in the body.
Okay, so for our listeners out there, they might be really struggling right now of thinking like, well, what the heck can I eat?
A lot.
Right. And And so it goes back to this whole concept of if you're eating a healthy diet, but you're not getting better, your symptoms are not getting better, maybe they're even getting worse, there's something going wrong, and it could be that it's a histamine intolerance. So, Dr. Janice, is there a way to diagnose histamine intolerance? Do we just do a trial of antihistamine medications for a couple of weeks, and if the patient gets better, then we think, oh, maybe they have histamine intolerance, or...
Yes, that is our principal problem at the moment, is diagnosis. Mm-hmm. Because there are, as I explained earlier, there are a lot of sources mm-hmm. of the excess histamine. And first and foremost, we have to consider where is the histamine coming from.
Yeah.
So is it coming from, for example, we'd be looking at mast cell activation factors. So are we looking at a person who's actually got mast cell activation dysfunction? There's one that needs to be diagnosed. We've got very specific tests for that. The next one, of course, is allergy. Are we dealing with an allergic condition? Let's look at that. Intolerance to food additives. There's another one. So these are diagnoses separate and distinct from histamine intolerance as a result of an enzyme deficiency. So let's look at the underlying factors and make sure that they have been ruled out before we just look at histamine and try to manage that on its own. Some laboratories offer testing for the levels of diamine oxidase in a person's system. Now, this is not on its own diagnostic of histamine intolerance. It just means a person is perhaps not producing quite enough diamine oxidase, but doesn't give us the actual measurement. We have no what we would call reference ranges at the moment because we don't know how that translates into clinical symptoms yet. One can measure the amount of histamine in the body, but that fluctuates throughout the 24-hour period. It's even got a circadian rhythm where the highest histamine level tends to be in early morning hours, perhaps between 2 and 5 in the morning, where people might experience their histamine intolerance during the early hours of the morning. That is not uncommon experience for people, because remember that histamine builds up during the day. It isn't I eat a food and I have a symptom as we have in allergy. It has to fill up that bucket first. And that could take several hours. And if it's at a histamine level that may be due to a circadian rhythm, it could in fact occur what seems to be the middle of the night, and a person will say, well, I didn't eat anything in the middle of the night. Well, no, because we don't expect the symptoms immediately. So it's a very difficult to measure histamine and say, oh, you've got histamine excess. You can't really do that because of its fluctuation, and secondly, because you have to wait for it to build up to that critical level before you see symptoms. We cannot do the similar test that we would do for a food allergy, where you give a patient a food and then wait for their reaction within a couple of hours, for example, or even immediately. It doesn't happen that way. So a diagnosis of histamine intolerance, separate and distinct from the conditions that I've already mentioned, is not easy to do. So, as you said earlier, a real method that is as accurate as we can get would be to try a histamine-restricted diet, and I have one that is very, very effective because there's no histamine-containing foods in it. You can find that on my publications, and follow that for a week or so, and if the symptoms abate, you can be pretty certain that you're dealing with a histamine intolerance. Antihistamines, yes, we can. That will help to break down. That does not help to break down histamine. All an antihistamine does is to block the histamine from reaching the cells that it turns on when we experience the symptoms of allergy. It does not break down histamine. So an antihistamine is not reducing your level of histamine. All it's doing is stopping it from causing symptoms. So an antihistamine will block the effect of the excess histamine, and yes, that would indicate that a person is dealing with too much histamine, but it's not going to solve the problem because it doesn't break down the histamine itself.
So then, Dr. Janice, would you say the best place to start is a histamine-restricted diet or a low histamine diet?
The best place to start is to go to one's doctor and to find out, first of all, do I have any of these conditions that could be releasing too much histamine? Because the histamine diet is not going to solve the problem if you don't identify a cause that's causing that histamine. But when all that is ruled out, yes, then go to the histamine-restricted diet.
Okay, so let's say the patient has gone to their doctor, they've rooted out some of the causes, they've tried a low histamine diet for a couple of weeks, they're feeling better. Now we're really suspicious they do have histamine intolerance.
That's correct.
Now, is this something that is going to be for the rest of their life? They have to stay on a low histamine diet, or will it get better over time?
Now, that's very dependent on where that histamine is coming from. Because we've got a variety of different triggers for the release of histamine, and one that a lot of your patients and mine, I'm sure, are experiencing is stress. Stress can release histamine, as you're very well aware, I know. And this can be a tremendously important trigger for the excess histamine. So when a person deals with their stress, very often the level of histamine drops sufficiently that they are not dealing with the excess, and they do, in fact, find relief of their symptoms. So it really is dependent on what is causing that release of histamine. Now, if they are dealing with a low diamine oxidase that they've inherited, then it's most unlikely that they will actually outgrow that, if you like, over time.
Yeah.
It may, there are diamine oxidase supplements that can be purchased, and this is diamine oxidase that is manufactured and extracted from pig kidney. Unfortunately, at the moment, we don't have any other source that is as effective as that. It's marketed under various names: Histame, Histamade, Diocin, a variety of names that will boost a person's diamine oxidase level just before they consume histamine in their food. It does not enter the body. It will not actually reduce a person's whole body histamine. All it will do will be to break down the histamine in a person's diet so that they can eat histamine in their food, and the histamine therefore doesn't enter the body. So there's that possibility. The low histamine diet, but most of all, find out where the excess histamine is coming from, and all of those factors are going to determine whether that's going to be a long-standing condition or whether a person is going to be relieved from their symptoms. There's another factor that I should mention before we end, and that is hormone fluctuations. This is very important in women, and sometimes women find at menopause, for example, when the estrogen, progesterone levels fluctuate tremendously, that they are apparently experiencing all these symptoms which they haven't had before. And that's because the hormones affect very powerfully histamine release. And so what we are looking at here is perhaps a transient experience for women. The other time we see this is at menarche, when a young girl first starts into having her periods, for example, that's when we see this fluctuation of hormones, and she may develop hives, a variety of the symptoms that I've mentioned. And again, this may be transient, that it only occurs during this period when the body's adjusting to these changed levels of hormones. So in a long answer to your question, there are various conditions which will influence whether a person does have to go through this for a lifetime, but usually it is a transient condition dependent on what is causing the histamine to rise so high.
Yeah, so basically I hear you saying it's complicated. And
yes,
it takes time. Just like everything, it takes time to figure out. So for the listeners out there who have, quote, tried it all and nothing has worked for them, they just might have histamine intolerance. It's possible. But even diagnosing that is difficult. Getting to the root cause is really about what it is.
Yes.
And then where can we find accurate information about histamine intolerance and a histamine-restricted diet and low histamine foods?
The most important thing in accessing accurate information on anything is to go to an expert source. Be very, very cautious, because what we're seeing now, of course, in our modern era of electronic communications is an awful lot of information available to us, which appears at first glance to be, oh, that sounds right, rather that I'll believe this. But so often this is coming from non-expert sources. And I've seen a lot on histamine intolerance on the web, for example, where people have had the experience of having histamine intolerance themselves. They've written about it in what appears to be a very expert manner, and they bring on board their own particular diets and the way that they look at the diets themselves, and people go, get a variety of different types of information as a result of this anecdotal reporting. Now, be very cautious and make sure that the source is coming from a very well based, what we call evidence-based research. Go to a very sort of a well-credited source, such as a clinic, for example, the Mayo Clinic or National Institutes of Health, that type. Do not base your self-management on these anecdotal reports that we get from non-professionals on the web. So look at the source, make sure that the person who is providing the information has at least a medical scientific background, so that they're very aware of the information that they're giving you is based on good, well managed research, and then you can rely on the information that you're reading. I think that's the most important thing. And also on the length of time that the reporter has been involved in the research. For example, just to give you an example, I started this research myself 25 years ago. So I've been developing my protocols and based on other people's research, on my own research, published in peer-reviewed journals, so that one can rely on that evidence that is very well based in science.
Dr. Janice, do you have a website that our listeners can find out more about you and about histamine intolerance, or is there one of your books in particular that they should look into?
Yes, my website is www.allergynutrition.com, and readers will find a lot of information on food allergies there. It's all food allergies, but there is a special section on histamine intolerance, and I have link to a site that is called Foods Matter, where I've answered over 100 questions on histamine from readers, the type of people who will be listening to your interview today, where their questions can be answered. And so from my website, follow that link, and hopefully by the end of this year, I will have an ebook which is totally devoted to histamine intolerance and all the questions that people have been asking me through the years, based on my research and research from other well-recognized sources, which should be available to download from the web. So that's another resource that's should be available soon.
Yeah, when that's available, please let me know. Because I'm personally interested as a doctor, because I'm always trying to, learn more. What am I missing? What do I need to learn about so that I can help my patients? And then, of course, so that I can also post that in our podcast show notes, so that our listeners can get a copy as well.
Wonderful. Thank you.
Dr. Janice, thank you so much for being my special guest today. This has been an awesome interview.
Thank you. I've enjoyed talking to you.
All right, that wraps up this very special episode of the Functional Medicine Radio Show with Dr. Janice Joneja. And I want to thank you, our listeners, for tuning in today, and I'd like to invite you back next week for another episode of the Functional Medicine Radio Show. As always, I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc. Have a great week, everyone.
You've been listening to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please tell your friends about the Functional Medicine Radio Show, and we'll see you next week with more from Dr. Carri.